probably run errands every day and don't give them much thought, like going to the grocery store, maybe a doctor's appointment, or even changing a light bulb that blew out in your home.
I'm Bill Zelenakis, and I'm a handyman for Partners in Care. I've been doing it since about 2008, and I just love it. It's helping people. I do just about everything from fixing storm doors to fixing televisions, putting up light bulbs, fixing walls, putting in handrails, you name it. When I'm helping people, it just makes me feel great when I walk away and see that they've had something fixed that may have been broken forever. I've always wanted to kind of do handyman work. Although I was an executive with the government, I didn't want to manage people anymore. I just wanted to go out and help people and do things with my hands. I joined Partners in Care, and I just love to work with people, help people. This is why I volunteer. When are you going to sign up?
Well, for some senior citizens, being able to do those errands can be the difference between living at home or living in a nursing home. But one program is trying to change that. On a bright, sunny morning, Christine Jennings needs to get to her doctor's appointment. But there's one issue.
I don't drive. My back is fused. It looks like a railroad track.
So the 67-year-old reached out to Partners in Care Maryland, a nonprofit that helps seniors with day-to-day tasks.
I called to get a ride to the doctors, and I was lucky to have Iris be assigned to me.
Everybody helps each other.
That's Iris Coley, a volunteer driver for the past 16 years.
I've done a lot of driving. I've enjoyed it, helping people.
At least it's a sunny day.
What makes this connection so different, though, is that both of these women give back to the organization in their own way.
It's always busy.
Iris drives, and Christine volunteers in the nonprofit's office.
I started out doing birthday cards, and now I'm into data entry.
And all that time they give comes right back to them.
Hi, my name is Jamar. I've been a volunteer with Partners in Care since 2019. I'm one of the drivers that transport older adults. I've driven 250 hours or 5,000 miles. Volunteering for me is very rewarding. I've been able to transport to grocery stores, their doctor's appointments, as well as food banks. And this allows the seniors to be a little bit independent, as well as having a good quality of life. For me, it's also very gratifying when I go to pick up an older adult and they have smiles on their face, they're happy to see me, and they're very grateful. As they get in the car, they're thanking me. As they get out of the car, they're thanking me, and they also have become friends. So not only do I volunteer as a driver, I've also used their services, their handyman service, and they have come out and trimmed my hedges for me, and they've also come and changed the batteries in my fire alarm. It's always been my mantra to help other people. So when are you going to sign up? Please join the community of Partners in Care volunteers to help provide a service to older adults.
Through a system called time banking.
That generation, they don't like to ask for handouts. So what can we do to make it where they would be willing to ask for help or to receive services? What can we do to make it as easy as possible so that they're willing to have a network and a community?
Mandy Arnold is the nonprofit's CEO, which runs background checks on the 800 volunteers in the program.
Our main programs are transportation, handyman, and then member care services. Our services and our mission is to support the independence of older adults, right? So that they can age in place, be an active part of the community, but also keep their dignity and respect.
That's where the time banking comes in. All the hours put in by volunteers can eventually be used by them when they get older.
I'm Eric.
I'm Donna. And we volunteer at Partners in Care.
We've been volunteering with Partners in Care since the summer of 2020. We wanted to do something where we could volunteer together. And this place has a variety of opportunities.
I work in the donation center of Partners in Care. We have electronics and lamps, we have books and puzzles, we have clothes and housewares, and we process all those things, what we're able to use, what we're not able to use, we pass on to other charities. What we have accepted, we bring to the boutique to sell to support the services that Partners in Care provides.
As a mobility driver, I transport people that are unable to maneuver, non-ambulatory folks in a wheelchair, and their caregivers. You get a great deal of satisfaction being able to go to their home, pick them up on the lift, transport them safely in the bus to wherever they need to go, and they're always appreciative. These are some of the reasons that we volunteer, and we think you should volunteer too.
So come join us and be part of an organization that changes people's lives.
And need help themselves.
It teaches you a lot and how to go about your own life, you know, and plan ahead for yourself, you know, in the future, because everybody's going to age and everybody's going to need help eventually.
It's a crucial need, considering the more than 55 million people in the U.S. over the age of 65.
The Biden administration did propose to add $150 billion more for home and community-based services, but it hasn't passed Congress.
Which is why Partners in Care caught the eye of John Shaw, who heads up the Caregiver Action Network. He says there simply aren't enough nursing home beds in the country to accommodate the growing need. His group recently gave a major grant to Partners in Care.
The only way we're going to be able to live through this, what I call caregiving cliff, you know, that we're headed towards, is really by putting supports in place so that people can live at home longer than they would otherwise.
When I go places and I tell people what we do and how we do what we do, they're always like, you know, do you have that here? I wish you had that there, because my parents or my grandparents, someone that they know could benefit from it. And so it is needed. It's needed all over the United States.
That's something Christine Jennings understands more than most.
We're a group of friends.
She retired from a career
A win today.
I know.
Beautiful though.
working for the State Department of Aging
So it's full circle.
in Glen Burnie, Maryland.
Thank you.
I'm Maya Rodriguez.